Good afternoon. I'm David Sweat, Deputy Director, Shelby County Health Department, and welcome to the City of Memphis and Shelby County Joint COVID Task Force press briefing for April the 22nd. Beginning with our numbers, up in Tipton County, Tennessee, we've had 7,235 cases reported so far in the epidemic. We've had 4,936 cases reported from Fayette County, excuse me. We've had 21,120 cases reported from DeSoto County in Mississippi, and 5,596 cases reported from Crittenden County in Arkansas. We've had 94,219 cases reported so far from Shelby County, and that includes 150 new cases that were reported yesterday. We're up to 1,600 deaths in Shelby County from the COVID epidemic so far, and that, as I have said before, it does make COVID the third leading cause of death here locally in Shelby County for the past year. It's also the third leading cause of death in America. Unfortunately, we can't do anything about heart disease and cancer in terms of a vaccine that would prevent those, but we do have a vaccine that can prevent the third leading cause of death locally, the third leading cause of death in America, and that is the COVID vaccine. So far, 298,610 people in Shelby County have availed themselves of that opportunity to be vaccinated, have 106,962 people who've had one dose of a two-dose series, and 191,648 people who are fully vaccinated at this time. A few minutes, Chief Doug McGowen will give us an update on the progress on the vaccine campaign, but even as we push acceptance of and uptake of the vaccine, we don't want to forget that the first part of the process in controlling the epidemic is understanding whether or not you have COVID disease. And the way we can find that out most efficiently is through testing. There are a couple of testing events that we are promoting right now that will be occurring on Friday and Saturday, and we wanted to make you aware of those. The first, in partnership with Latino Memphis, Friday, April 23rd from 2 to 5 p.m. at 6041 Mount Moriah Road, 6041 Mount Moriah Road here in Memphis. We'll have a testing event that is open to everyone 5 years old and older. First 150 people who come can get tested for free at that outreach event between 2 and 5 p.m. Then on Saturday, April 24th, from 10 a.m. to 1 p.m., in partnership with Riverside Baptist Church. It's a drive-through testing that's available at 3560 South 3rd Street in Memphis. So either Friday afternoon or Saturday morning, if you're having symptoms or you need to know your status for some other reason, you're getting together, you've been exposed to a case, you need to find out whether you're infected, whatever your reason is that you might benefit from testing, please come out and get tested. Or if you don't get tested in one of those events, please take advantage of one of the almost 17,000 community test site appointments that are still available throughout Shelby County for people to learn their status, and if they are positive, then isolate to protect themselves, protect others from their infection. With that, I'm going to invite Chief Doug McGowen to the podium.
Thank you, David. Just a quick update on the vaccines. Just checked the numbers before I came over, and so far we have delivered 490,000 vaccines to people in Memphis and Shelby County. That's 490,000 individual vaccines. And as of 11 o'clock this morning, 302,000 people have been vaccinated with at least one dose in Shelby County. That's 32% of our overall population. But I want to talk for a minute about an intermediate kind of milestone. 302,000 people is 32% of our overall population, but of the eligible population, that is people who are 16 and up, that's 41.5% of people who are eligible to receive the vaccine have received one. And that's pretty impressive to have 41%, but we're clearly not where we need to be. There are 937,000 people in Shelby County. 16 and up, there are 728,000 people. So If we wanted to get half of the people eligible, means we have to get to 364,000. If we wanted to get to 70% of the eligible people, 510,000. We know our aspirational goal is 700,000 overall, but of the eligible people, 70% is 510,000. So that's a good milestone to measure ourselves against. We are not there yet. We are committed to vaccinating as many people as we can, as fast as we can, and I want to take just a moment to say that the next 4 weeks are critical. The next 4 weeks are critical. Yes, we've had 302,000 people take advantage of the vaccine. We know we need to do more than that. But we have enjoyed capacity that other cities have not enjoyed. Today, we can do more than 60,000 vaccines per week. But on May 17th, the capacity that we have enjoyed because of the partnership with FEMA and the Department of Defense, it is scheduled to be drawn down on that date. That partnership has brought us an additional 21,000 doses per week. That partnership has brought us nearly 200 individuals to help us put shots in arms. But that time is coming to an end 4 weeks from now. On top of that, the leases that we have put into place for some of our mass vaccination sites will be coming to an end in May. And even more, some of our partner sites that we have established across the community are planned to draw down on around May 22nd. And so this next 4 weeks is critical. The capacity to do 60,000 vaccines per week over a 4-week period of time means we could get another 240,000 people vaccinated if everybody took advantage of that. Again, 60,000 vaccines a week, but as of this week, we're on a pace where we'll be lucky to hit 20,000 vaccines this week. It's going to be inefficient and ineffective to continue to have that imbalance of availability versus uptake for a very long period of time. So after the week of the 17th, when the Community Vaccination Center at the Pipkin building, when we plan to draw down some of those DoD resources and that additional vaccine, we will take a look at the demand that we have at that time versus the capacity we have to deliver. And you could and should expect us to scale back our ability to deliver to match the demand at the time. But I want to be clear, between now and that 3rd week in May, we are going to maintain the capacity to do 60,000 vaccines per week. That is a sacrifice that our communities are making. It is a sacrifice worth making. We have a lot of people engaged in that work. We're spending a significant amount of resources to do that, but it's critical. If the demand does not pick up after the week of the 17th, and we do scale that back, what that means is that it will just not be as easy or convenient for people to get their vaccine anywhere in the county. And people may have to take advantage of some of the private enterprises that are offering vaccines. Nothing wrong with that. Walmart, Walgreens, CVS, all great partners. But it won't be as simple as just simply driving to one of the 5 or 6 fixed sites to get a vaccine. But we're trying to do everything we can to drive up demand in the short term. We've made a bunch of adjustments along the way. We did a community vaccination event last week. We gave out some gift cards to try to drive some new demand, and we're going to make some changes going into next week as well. For this week, even today, we have a new site that was established on Tuesday. So today, out at the Guild campus of Southwest Tennessee Community College, which is on Mountain Terrace Road in the Fraser community, we are vaccinating until 5 p.m. There is a $20 Kroger gift card giveaway happening at that site today. We have several hundred gift cards still available, so I encourage people, if you're thinking at all of getting a vaccine, that's a wonderful place to go. No appointment is necessary. And come on out and see us before 5 p.m. Tomorrow, at the Raleigh site, which is at Greater Amani Church, and at the Whitehaven site, which is on Elvis Presley Boulevard at the Southwest Tennessee Community College, we will again be doing a gift card giveaway. We have almost several thousand gift cards to give away, and we'd be happy to see you at either of those sites tomorrow to get your gift card along with your vaccination. Now, moving into next week, we understand that there are people who like to have an appointment, and there are people who don't want to have to worry about getting an appointment. So next week, at nearly all of our sites, you will be able to come in with no appointment necessary to get a vaccine. We will retain the ability to have appointments at each of our sites during the course of, to have an appointment at some of the sites next week. For instance, on Monday and Tuesday of next week, no appointment is necessary at the Germantown and Collierville site. But on Wednesday, Thursday, and Friday, they will be taking appointments. At the Pipkin site, for instance, we may take appointments in the morning and have it wide open for first come, first served in the afternoon. So, the summary of that is that there will be much more availability all across the county for people to show up and simply get a vaccine without having to worry about having an appointment. I do want to make the point that there is a trade-off for a no appointment system. And that trade-off is that there will be a fixed number of vaccines available at those sites where there are no appointments. This is so that we do not have an overabundance of vaccine in the community that we will then have to either try to bring back or administer through the evening and potentially waste some doses. With appointments, we predict how many people will come. We provide just enough vaccines to meet that demand, and it minimizes the possibility of wasting. For a no appointment scenario, we deliver a finite number of vaccines, and when those vaccines are out at that site for that day, that site will close. So that's the trade-off between having appointments and no appointments, and we hope that that meets the needs of most people in the community, those that would like an appointment and those that don't want an appointment. I encourage you, if you don't want an appointment though, to show up at one of our sites early in the day so that you can take advantage of one of those vaccines before they run out. Now, we will communicate the details of this on the website, covid19.memphistn.gov, via social media on Twitter and Facebook, on the Nextdoor post, and we will push this out also via the Mayor Strickland's email to many of you who receive that. We will let you know how many shots are available at each of the no appointment sites each day, and should we run out of vaccines at any one site on any particular day, we will adjust the next day to provide some more vaccines to meet what we see as an increased demand. So to summarize, next week we're going to make another pivot. Nearly all of our sites will be available for no appointment. We will retain some sites where you can sign up for an appointment, and those will be available on the covid19.memphistn website. I ask those of you who would like to get a vaccine today to go out to the Fraser site at Gill Campus of Southwest Tennessee Community College. Tomorrow, go on down to Whitehaven or up to the Greater Amani site in Raleigh and take advantage of a gift card. Or come on out to the Pipkin building, come on out to the to the Faith Baptist site out in Bartlett. Take advantage of the opportunities we have at Germantown. We still have appointments available today, and we'd encourage you all to come out. It's beautiful weather. It's a beautiful day tomorrow. Come on out and get your vaccine. I'll wrap up by saying the next 4 weeks are critical. We have a unique opportunity in this community to have Department of Defense resources here and an additional 21,000 doses. 302,000 of you have taken advantage of the vaccine. We need another couple 100,000 so that we can be well on our way to achieving our goal of herd immunity, and we have the opportunity to do that. So with that, I'll stop and take any questions that you might have.
Kelly Roberts, WMC.
Hi, Kelly.
Hey there, good afternoon. My first question is about that Fraser site you mentioned, and I saw that you are giving away gift cards there. I know that it's a 2-day open site. The first day that it opened was Tuesday. Can you talk about what the show looked like there? Was it a low turnout? And I know that it's obviously a very important place. It seems to have a site from the press release from Shelby County Health Department with the growing variant cases in that area.
Sure. So it is a very important site. It's strategically located in the community of Fraser for convenience. We have two things happening there. There was a number of a relatively high rate of the variants happening in that community, as well as a low uptake of vaccines. So having that presence there is important. Yesterday, we had the opportunity to provide as many as 300 vaccines. Less than 100 were administered at the site. We attribute that to being the first day that it was open. So today, a slightly improved take rate this morning, but still not the rate at which we would like to see it. So we are putting the word out. Hopefully, people are hearing this today. We have engaged our city council persons to use their social media to advertise and get out to their constituency. And so we just encourage folks to come out there and see us. There really is no line and no waiting and no appointment necessary. We have the Shelby County Health Department nurses who had been administering some vaccines at the commodity food site have moved their operation over there. So it's a wonderful opportunity to get a vaccine in that neighborhood.
Thank you. And my second question is about the website today. It looks like late this morning it kind of went down, and now there's some maintenance being done. We had a few viewers reach out to us kind of concerned about looking at the schedule or making an appointment. Do you have any update on what's going on with the COVID-19 memphistn.gov?
I do not. Thank you for bringing that to my attention, Kelly. That may have, I know that there was an issue this morning with the website. IT issues do occur from time to time. My message would be, please just check back with us. Call 222-SHOT. We will have, there's appointments still available today if you would like to get one. If you're thinking about getting an appointment next week, don't worry. We have, again, 60,000 opportunities for you to get your vaccine, whether it's your first or your second vaccine. We'll do everything we can to get the website back up. I think given that, it's equally important to emphasize that there are lots of opportunities for people to come and get a vaccine without an appointment. Today you can come down to the Pipkin building until 7 o'clock tonight. You don't need an appointment. Just come on down and show up and get your vaccine. So I'll get back with you. I'll try to find out from our IT team what's happening with the website. I expect it to be back up by now. So I don't think it's any critical issue, but it could be just one of those glitches that happens with your website from time to time.
Michaela Watts, Commercial Appeal.
Hi, good afternoon, everyone. Doug, since you're already at the podium, I'll start with you. FEMA leaving town on May 17th. Can you confirm that they are for sure going to pack up and leave on May 17th, or is there a possibility that they could extend their stay? Originally, I believe they were going to be in town for 6 weeks. May 17th will be the end of that 6 weeks. And
Right.
If we see vaccine uptake increase, is there a possibility they'll stay, or are they certainly going?
I think all of our collective, so let me come back to the beginning when they came for this engagement. It was a 6-week engagement with the possibility of extending it by another 2 weeks based on the demand that they saw. Based on the demand that we see today, it's unlikely that they would extend that stay. And when you say definitively pack up, it is our collective hope from FEMA, the Department of Defense, that we have such an overwhelming response that we all collectively say, we would love to have you stay for an additional 2 weeks, and they would love to do that for us. They would love nothing more than to stay for another 2 weeks to help us deliver at least 3,000 doses a day at the Pipkin site. But should the utilization not be there, I think we all collectively understand that that's a significant underutilization of resources. They may be able to be deployed to another location that has a demand that's higher than ours. Today, the delivery of vaccine is only slightly higher than it was with our just general Pipkin throughput. That's an unfortunate a byproduct of the timing when the demand started to slide off. We were all hopeful that we'd be packing the house every day with 3,000 people getting a vaccine. So to summarize that, the 17th is the planned drawdown of the 6 weeks. If demand picks up significantly, we will obviously reevaluate that. We have been able to pivot on a relatively short timeline, and the entire team is ready to do that should that become the case.
Great, thank you. And my follow-up question is for David. It's related to testing. David, are you concerned that the continued decline in testing is going to decrease our ability to stop the spread of the variants or detect the presence of new variants?
Well, thank you for the question. And obviously, in order for us to do sequencing, we have to have somebody present to be tested. And what we do know is that testing tends to ride with the epidemic curve. In other words, as more people are experiencing illness, more people come get tested. We also know, though, that there's a bit of fatigue, right? Whether it's with the vaccine or testing or whatever, there's a bit of fatigue with the effort to control the epidemic, or fatigue with the epidemic. And so what we want to remind people, and that's part of why we had Dr. Lieberman here earlier this week, is that at this time of year, a lot of people tend to experience some sort of respiratory difficulty because of the change in the weather, or they have an allergic reaction to something. And we don't want people to mistakenly believe that the symptoms they're having are somehow just normal. If you're having any sort of symptoms of sore throat, achiness, headaches, shortness of breath, fevers, those sorts of things, those are not allergy symptoms. Those are not normal. And we want to just keep reminding people that we've made a huge investment here in Shelby County. In fact, Shelby County and Davidson County are the two most heavily tested counties in Tennessee. So we've made an investment of resources and partnerships to make sure that if you need to be tested in Shelby County, that it's easy to do. And not everywhere in Tennessee is that true. Not everywhere in America is that true. And we are committed to maintaining that capability. So even as the vaccine campaign became the focus beginning in December, we have maintained almost 17,000 weekly community-supported test sites throughout Shelby County. And we continue to do outreach testing events like the two pop-up events that I mentioned earlier. So we're committed to testing. We're committed to testing so that people can find out if they have COVID and they can isolate, or we can identify their contacts and quarantine them. We are also interested in the sequence results. So during this week, in addition to seeing all of the UK strain variants, the B117s, which is the predominant strain, we've detected some evidence of a strain out of New York. We found another introduction of the P1 variant from Brazil, and we've had a single case of a South African strain. So we do need people to get tested so that we can identify those variants with public health concern and respond to them with our priority investigation teams. But across the board, the main reason to get tested is so that you can identify for yourself, do I have COVID? And if so, let me isolate and protect my loved ones, my friends, my coworkers. But also, let's be aware of the signs and symptoms of severe and worsening disease that may give you a signal you need to go to the hospital. So all of those things are made easier to do if you know for sure what your status is, and that's why we want people to keep testing.
Mandy Rock, Fox 13.
Hi, good afternoon, everyone. So on Tuesday, you guys said that it may be difficult to reach herd immunity in the county unless more people do come out to get the vaccine. So my question just is, what is being done to overcome vaccine hesitancy? And at this point, do you think that the incentives are working or not?
Well, and I'll invite Doug to comment on this as well. We are working with partners to try to put together a coalition. In coming weeks, we hope to do that, to have a coalition of the community to give us their feedback and input on how we can reach people better with messages and vaccine, and increase people's acceptance of and willingness to be vaccinated. We're also working with the academic research partners to try to do some actual formal research around those questions. We're trying a variety of efforts that Doug's already mentioned in terms of incentivizing it, and we'll be looking with our public information and communications people at ways we can create communication advertising campaigns, basically, to promote vaccine awareness and vaccine acceptance and uptake. We're going to continue to try. We're going to try everything that we can think of to try, and we're going to try everything that evidence suggests might work. But I'm going to invite Doug to come and comment also on that question.
Sure, thanks. And I think it's a really good question. And we are doing work in that area, everything that David mentioned from the messaging, but it's not just the messaging, it's the messenger. And so, as you know, we have more than 25 church partners who we've delivered community pods with, or will be delivering community pods with, and that's part of it, is the education component, the trusted messenger that's delivering the message and delivering it in a place that's convenient for individuals. So we will continue to do that. I think there's some component of discussions and more education without, before people are actually presented with the opportunity to do the vaccine. So we'll look at some of those as well. You asked me about the incentives. Are they working? We did see an uptick when we offered some of those incentives. We will continue to look at that. We have asked folks to look at some of the, the psychology of vaccine hesitancy, the psychology of the behavior around vaccines. And it appears that there is no one answer that addresses the vaccine hesitancy, but it's a number of things. It's for some people, it's doing it to protect people around them. They may not think that they need it themselves, but it's about appealing to their desire to protect those that they care about. For others, it really is about breaking down misinformation and providing people with good information. We have heard reporting from many of you when you talk to individuals that they just have inaccurate information, believing that a test will give you COVID, believing that the vaccine is going to, kill you. Those kinds of things, we just need to give people the right information and let them make a reasoned choice. David said we're not going to quit, so we will not quit, and we will continue to do everything we can to get the correct information out there to individuals.
Great, thank you so much.
Jane Roberts, Daily Memphian.
Hi, thanks for the chance to ask a question. Last week you said that we would know if this were a blip or the beginning of the fourth surge. What do you think? And then I have a follow-up too.
Well, I'll turn that over to David for that, but Jane, let me thank you. You responded last week. I think either you or someone else asked the question about what other kinds of things are you doing, and I said, I would love to hear your ideas, and Jane, thank you for being thoughtful enough to send along one of your ideas. It's a good one, and we'll take a look at doing that if we can. So, David, on the fourth surge.
Yeah, thank you, Jane. As I went over in pretty good detail on Tuesday, we are in a period of growing the epidemic once again because the reproductive rate of the virus is above 1. It's at 1.13, the last it was calculated yesterday. So we know that the future number of cases is going to be higher than the current number of cases in this epidemic. And that's going to continue to be true for however long it is that the reproductive rate of the virus stays above 1. So from a common sense point of view, what I would say is, yes, we're growing the epidemic right now, and we won't see that change until the reproductive rate of the virus dips back below 1 and we begin shrinking the future of the epidemic. We're not the only part of Tennessee that's observing some increases. we're also not the only part of the Mid-South that is observing some increases. We have statistical evidence that cases are on the increase in DeSoto County. We have some statistical evidence that cases are increasing in Fayette County, the upper Cumberland region, up in the northeast region of Tennessee, around Sullivan County and some other places. So Tennessee has various spots that is beginning, and the Mid-South has various spots that are beginning to see the case rates go up. We are one of those places.
My last question, actually, the vaccination rate in Shelby County is keeping pace with the state, but it seems to be below some of the sister cities like Jackson, Mississippi, St. Louis, Little Rock. Any reason?
It's really hard to say. I mean, it's hard to say. I mean, basically, from another point of view, if we could just sort of pull back from out just being narrowly focused on our own community, we need everyone in America, in all the cities and all the states in America, to respond positively to the opportunity to be vaccinated, because we really are all in this together. But as far as Chief McGowen, I don't know if you've had conversation with any of the other cities about the vaccine issues. I'll invite you to comment if you have.
Well, everybody's seeing kind of the same phenomenon of a drop in demand, and there really seems to be no pinpointing the exact cause. I think, as you said, we are keeping pace in the state of Tennessee. We were slightly behind, and now we are on pace with everybody here. And in fact, I'm incredibly proud of this community. As you know, we have delivered, as I mentioned before, almost 490,000 vaccines, and that's almost 70,000 more than the next closest county has delivered. So I'm incredibly proud of the work that this community has done together, this county, all of the municipalities together, the healthcare systems, the volunteers, the universities, the students, who are doing a lion's share of this vaccination work. It really is unprecedented level of effort that we have here together. And, I think that we are doing everything that we possibly can, certainly providing every opportunity, again, 60,000 opportunities each and every week. And this week it looks like only 20,000 people will take advantage of that. That's an incredible and unprecedented opportunity for us to really get ahead of this thing and to leap ahead of all those other cities, because they don't have the benefit of this. I think St. Louis does. But again, I would mention that the community vaccination center that we have at the Pipkin, though it is not meeting the aggressive goals that we have, it is amongst the top performing ones that have been established in the southeastern part of the United States. So we have a lot to be proud of here, but we do need to get the word out for folks to jump on board that success and help us get to another level of vaccination and ultimately herd immunity.
We're out of time. Are there any other closing messages today?
My message is what I started with. Let's not let this opportunity go by. We have this unprecedented opportunity of federal, Department of Defense, state, and local cooperation that provides us this huge capacity to vaccinate people in Shelby County and the surrounding communities. We ought not squander this opportunity to get as many people vaccinated as quickly as we can. Should the uptake and the increased demand not be there, then we should rightly expect that when the 6 weeks is over, that opportunity ends for us. But I think that together we can come and show that there is demand here. My hope is that we could get up to that maximum number, but my fear is that we will not get there. So encourage everyone to come out and get vaccinated at any one of our sites that we have. The next 4 weeks is critical in our race to beat this pandemic. The next 4 weeks is the opportunity we have to do it. And after that, our opportunities are more constrained for the broad-based vaccines and will be much more precise and targeted through individual vaccination efforts. So please come on out. Memphis in May is huge. We are not having a festival, we're having a barbecue event. So let's substitute the great efforts that we have typically in the month of May, pour that energy into vaccinations so that we can get on with a great summer here in Memphis, Tennessee. Thank you.
Thanks, everyone. We'll see you back here next week.